The Lifestyle Show.
Well, we played this song on purpose. Formula. It has a line alokola era awonya. Alokola awonya na yes, to be specific, tajanjaba. Okay? He saves, he heals, but he doesn't treat.
So
what he does, he treats through
medication.
Christians be guided. Okay? Many men of God are telling you not to do medication. And the truth is, medication is a necessity.
Yeah.
Because that's where the treatment is. God heals. But however, he treats through the professions like a doctor that we have right here. So be guided, and I'll be sure that at least go to a hospital for a diagnosis and make sure that you get the right prescription for what you're supposed to do.
And then don't forget to also pray.
Okay? Please be guided. We're still talking about bacterial infections, and trust me, like doctor said, anyone can develop bacterial infection. But again, factors such as compromised immune systems, environmental exposures, poor hygiene, many of those can actually lead to that. Now, I want us to engage in a conversation of what are those signs and symptoms that someone can really look at and be like, yeah, this is likely this, so let me see the big.
Okay, thank you, Mr. The signs and symptoms of bacterial infection are actually the commonest signs you all know. A sign is actually what you observe, what you see on a patient is what we call it a sign. That is like if you touch on the patient, the forehead is hot, that is a sign. You feel the temperature is high. The patient can be shivering, you'll be seeing the patient, that is a sign. Then when we go to symptom, is what the patient is complaining. Meaning you cannot see a symptom. The patient has to tell you that I feel headache. You cannot see that he's feeling headache. He has to tell you. So signs are basically signs and symptoms. That is the temperature being high. That is one sign that there is an infection. Chills, muscle aches, fatigue. Those are some of the main signs of all infections, including bacteria. Okay? So signs and symptoms are not different from even actually malaria and bacterial infection in signs and presentation is the same.
How do you classify joint pain?
Joint pain.
Those are the X, right?
Those are also extra signs of the infection. So that's why when you come to the hospital, we always say, the temperature is high. We are suspecting, is it a bacteria? Is it a malaria? We can take off blood and we test and we'll be sure what is there. But signs and symptoms of bacterial infection are almost the same as signs and symptoms of malaria. Yes, they don't differ. Loss of appetite, vomiting, diarrhea, and other signs of bacterial infection. It depends on the part which the bacteria is affecting. So if it is affecting the urinary system, a patient can say, when I'm going for a short call, I feel pain when I'm urinating. A patient can say, I'm feeling itchy. You can examine, see a patient is having a poor discharge or bad discharge in her private parts. All those shows that there is a sign of a bacteria now. So other signs goes depending on the part being affected. But on the general signs of bacterial infection, it is always high temperature, chills, fatigue, headache, muscle aches, including joint aches and so on. Those are the commonest signs. Yes.
For a minute, doctor, when you just said signs and symptoms and you explained the signs, as if I've never got to know the difference between signs and symptoms. I thought that runs together, signs and symptoms.
No. So signs and symptoms are, a sign is something which you can see and observe.
Yes.
That is a sign. Then a symptom you can't see.
I feel it. The one who is sick.
Complaining.
Dave.
Yes. The patient has to complain.
I have to call out Dave. Yes. But thank you so much, doctor.
Welcome.
So what could be the causes of those infections, especially the bacterial infection. I think it's a
Yeah,
word
we
that
are
is really
tackling
common.
bacteria because it is the commonest.
Yeah.
So at first I told you about that the bacterial cells within our body are more than our body cells.
Yeah.
And unfortunately, that bacteria cannot be seen by our naked eyes. And it is everywhere. So being everywhere, meaning every time we are on a risk of contracting it. But the commonest causes are poor hygiene, of course. Either you were talking about Kampala having the rise in bacterial infection, the hygiene within the city, you know, it's not all that. The water we are using, the congestion in the city. Because, for example, if I had the flu and cough, which is a bacteria type, I can easily leave it here in a studio, and in the evening find one of you is having it. Yes.
Oh.
So you can see the causes are within us. Yes. So basically those are the main causes. And if we go to treatment, of course, the only treatment of bacterial infection, because when I talk about bacterial infection, it means it has already accessed our body. I'm talking something which is already in our body.
Yes.
So treatment and antibiotic should be number one. There are a lot of antibiotics, and generation after generation, you have, even we are producing new antibiotics. There are some, we have first generation, second generation, third generation. So you find because of technology and so on, antibiotics are being improved here and there. So antibiotics is the number one. If we confirm that this is a bacterial infection through tests and maybe clinical observations and the assessment, an antibiotic should be always applied, either through IVs, what you call cannulas and so on, or can be tablets, syrups, even kids. Yes.
The
food vendors.
Yeah,
Yes.
the food vendors. I think that's a reason. I think that's a reason why so many people in those malls, they have cannulas on their body, but
the hygiene around
the food they eat, it's the food, the juice.
You know, like you can have a watch. Yes, cannulas are becoming like watches downtown.
Yes.
But doctor, I am confessing, I suffered a bacterial infection.
This is what you are waiting for.
A confession. I suffered a bacterial infection that was reoccurring most of the times, and I came direct to you. And there is a cultural sensitive test. How was it?
Actually,
it's
I wanted to bring up in investigations what we do in case bacteria, because we have these common tests we normally do for all patients who come having signs and symptoms of a bacterial infection. One is we call it complete blood count, or CBC. If we do a CBC, usually in its parameters, it will bring us to know that this is a bacterial infection, and it even helps us to know how high it is, which will help us in the planning of treatment.
Okay.
That's why sometimes the infection is not much.
The
mild
infection.
Mild, according to the results, and sometimes according to the signs and symptoms of the client. And we find that tablets will clear. Or we say, no, the tablets will not clear. Let's first do injections for 2 to 3 days, then we shall conclude the dose with tablets.
Yeah. So, doctor, I was going to tell you what helped me so much when you did the cultural sensitivity method, because then you told me, you told me the exact medication that I'm supposed to use. If you can elaborate for a listener out there who is also suffering the same, maybe they're actually even buying the most expensive drug on the market, but it's not working.
Thank you, Madam Joan. So, our dear listeners, there is what we call culture and sensitivity. Culture and sensitivity, when we talk about bacterial infection, it's like picking a sample of either blood or any part which is affected by the infection. For example, if it is urinary system, we can pick even urine and we use it as a sample. We take it in lab. Then the culture is like growing the bacteria now.
Again.
Culturing bacteria is like, we have a culture media. It is something which has nutrition foods which a bacteria can feed on, then it grows. Because for it will be comfortable eating, thinking that it has gotten what to eat. For us, as we are monitoring it, after its growth, we now go to sensitivity part. Sensitivity means we try different drugs on killing those, on that bacteria which has grown. Then we shall get to know which medicine have managed to kill the most bacteria. And we'll recommend that patient that is the medicine which is now killing the most bacteria.
How long does that process take?
That process takes, depending on the sample which you have taken. For example, if it was a urine sample, it can take 3 to 5 days to get that whole biology. So culture and sensitivity is very important, especially with the increased resistance of bacteria infection failing to clear. It will help us to know the exact type of bacteria which is affecting you. Then again helps us to know the exact type of medicine which can clear it, and even tell us some medicine which cannot clear it. It will give us 3 parameters.
You're speaking all these things. I wonder if every medical day is doing all this. Because
do they know about it?
This is like a solution thing that someone needs to do, every medic needs to do. But then, as we're running off, I want to ask 3 questions that I'm going to answer at once. One is, do bacterial infections go away on their own? Because there's been that narrative that some go out on their own. I want you to confirm that. The other is, how long do bacterial infections usually last? Averagely. The other is, how do you tell if it is a viral infection or a bacterial infection? There's been some misconception. Help us address those.
Thank you, Mr. So, the first question you are saying what?
Do bacterial infections go out on their own sometimes?
Yes, that is true. Sometimes bacterial infection can clear on their own, but it will be depending on what the individual's immunity is and what extra is he or she doing. For example, if someone is taking multivitamins and the vitamin C, something to boost the immunity, you can eventually clear some bacteria and find they have gone. We normally tell you, the people who are suffering from UTIs, you drink a lot of water, because water itself can clear the system. So depending on the type and how high it is the reason why you can tell sometimes they clear, sometimes they don't clear. They severate.
Okay.
Yes.
The other one is, how long do bacterial infections last usually, like averagely?
So bacterial infection usually, once they access your body and you are not on any treatment, as I've answered the first one, they will clear depending still on what the individual is doing. If maybe the source is terminated, the source which was bringing the bacterial infection is no longer there, the hygiene has been improved, immunity has been improved, you find within 2 weeks they can clear. But even when we are on treatment, we usually see depending on the bacteria affecting you, but usually the dose for bacteria normally grant to 5 to 7 days. Usually we don't if we expect by 5 to 7 days, this bacteria should have cleared. If it has not cleared, it means it has resisted. Now we have to think about the culture and sensitivity I'm talking about. Yes. So on average, by within 2 weeks, if we are dealing with a bacterial infection, it should have cleared, and if we are doing the right thing. Beyond that, it means we have to reinstate and reinvestigate again. Maybe it is not. Or we are using things which are not working for it.
Is there a way you can differentiate between a viral and a bacterial infection before going to the doctor?
You are the person, a client. It is so technical to differentiate the two. But when you go to a medical doctor, any health worker, depending on the signs and symptoms of a patient, someone can say, we may not conclude that it is 100% viral, but it will give you a clue of where this could be a viral or a bacterial. But when we do some tests like how I've told you, CBC, complete blood count, for it can direct us. If it is a viral infection, it will bring us some signal this is a viral infection. If it is a bacterial infection, it will still show us. where, and most of the time it can bring both, showing that the person has mixed infection, both viral and the bacterial.
Wow.
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 That sounds like my take home is you sounded like we are spending a lot of money.
Yeah.
Clinics, and yet we should even do better as easy as hydrating, keeping a lot of water in our bodies. I mean, there are home
diet,
and also there are more home remedies someone can actually apply before going to a hospital. On a later note, have you suffered a bacterial infection and how did you treat it?
I personally, I'm always conscious on what I've touched, what I've eaten. I've ever suffered, but it was I've ever gotten a food poisoning.
Oh,
yeah, bigger. That's also
and it is also bacteria.
That's another one, yeah.
So I got a food poisoning, and I suffered from it. But I was still a student. I think I was a medical student. Ever since I became qualified, I think I've never suffered from. I suffer mild, and I treat also like others. Especially this flu and the cough. It can also attack me because I'm also working. For example, when I overwork in overcrowded wards of kids, and because I usually treat most of the kids, they usually spread it to me.
Oh.
So you find I'm in the long run, I also have it, but I normally treat you. I feel the one sign, I know what is happening in my body already.
Yeah.
I just go for the medication.
Yeah. Thank you, doctor, very much. That is so educative. I feel like I've learned enough. And I'm sure one of you has learned something.
Yes.
But just to ask, which facility do you work with?
I work with Andrew Medical Centers. There are many branches. There's one branch here at the Shore House, Bombo Road. That is even Ebenezer. Then another branch is in the Wakiso. That is Kachiri town.
Okay.
Yes. So there is some organization called SOS Villages. That organization which looks after vulnerable kids. These kids who have no parents and so on. So medical part of that group, we are the one handling.
Oh, wow.
Amazing.
That's amazing.
How do people access you through any contacts in social media?
Yeah. Yes, I have a mobile phones, both lines, and I'm on WhatsApp, I'm on Facebook.
The names.
The names?
Those handles, the numbers. If anyone would want to contact for treatment, because how you've spoken about the cultural sensitivity, I'm like, I should not suffer again.
Okay, my numbers are Airtel, which is on WhatsApp, is 07536 039 39.
Again?
07536 039 39. That is the most accessible, because even on WhatsApp, even if you say, hi, doctor, what is this? We can talk. And I have a lot of time. I normally give my patients and my clients time on the phone.
Okay.
Joanne knows better.
Yeah, I know. That's
Joanne was given a lot.
My doctor.
I do when someone contacts me. Really, there's a way I'm too passionate on my profession. And when someone texts, even if I'm doing what, and I say message, doctor, I'm not okay. I need your attention. You see my reply instantly without
confession too. I've texted him at 3 asking about my son who was sick, and he replied. So really, he's a doctor to keep.
Yes.
Amazing. Thank you, doctor.
Kampala Love Spirit FM.